Okay, this video is about the circulatory system in the fetus pig. This region here is the thoracic cavity, which contains the heart, the lungs, and a membrane that's been cut off now. This quite thick membrane here is called the diaphragm. The peripheral side here that we talked about last time, this is all the abdominal cavity that contains the digestive organs, the excretory organs, and also the reproductive organs. We're going to look here today at the thoracic cavity. I've opened the rib cage. This is the rib cage. I've opened this up, and these structures that you see here, these flaps, these are the lungs. This is the heart right here. Now, if we go up here, coming from the mouth down, this here is the larynx or the voice box, and air comes in through the mouth, goes into the trachea, and I've opened it. It's a tube, a hollow tube that contains air. Air comes in through the trachea, down into the right or the left lung. Okay, so let's focus on the heart for a minute. There are two structures here. These are blue. These are two veins. It's actually called the vena cava, the superior and the inferior vena cava, that supply the blood with the heart with blood from the body. So this is going to be deoxygenated blood. However, in the case of the fetus, since the lungs are not functioning, the blood doesn't get oxygenated through the lungs. It actually gets oxygenated through the maternal blood, and this maternal blood enters the fetus through the a vein here, and right here, and it joins with the inferior vena cava and enters together with the superior and inferior vena cava. They enter the heart in the right atrium. So this is the right atrium, this is the left atrium, this is the right ventricle, and this is the left ventricle. What you see here transversing along here is the coronary artery and the coronary vein together here that actually supply the heart itself with blood. So blood enters the heart, deoxygenated blood enters the heart through the right atrium, and normally it would travel into the right ventricle, where it would be then pumped into the lungs through the pulmonary artery. This structure right here, this is the pulmonary artery right here, this big white structure here. Pulmonary artery would then go into the lungs, come back through the pulmonary veins, into the left atrium, the left ventricle, and then out through the aorta, which is right here. Now in the fetus, it's going to be a little bit different. The blood comes in through the right atrium. It's a mixture here, then the blood that comes into the right atrium is going to be a mixture of deoxygenated blood and oxygenated blood that's joining into this superior vena cava from the mother. Comes into the right atrium, and there's a shunt here that bypasses the right ventricle. So the blood goes from the right atrium to the right ventricle through a structure called the foramen ovale. It connects these two atria together. So the blood gets pumped from the right atrium to the left atrium, from the left atrium into the left ventricle, and then out through the vena cava. Now some blood does actually get into the right ventricle, and that goes into the pulmonary artery, but it doesn't go to the lungs. Instead, it's shunted here by a structure called the ductus arteriosus, which connects the pulmonary artery, this, to the pulmonary artery is connected then to the aortic arch right here through a structure here called the ductus arteriosus, would be right here. Pulmonary artery, aortic arch, ductus arteriosus. So it's shunted, instead of going into the lungs, it's shunted right into the aorta. And then the aorta then pumps blood to the head or to the body. And you can see a very big branch of the aorta back here. right here, that would carry oxygenated blood to the rest of the body. Okay, and I said this is the trachea, and this is the voice box, the larynx, right here. That's it.